Clear talk, better care, essential English for healthcare. Introduction. Welcome to all who work in healthcare in an English-speaking place. You bring much knowledge, kindness, and a strong wish to help people get well. We know it takes a lot of work to learn your job well and then to learn a new language. This is especially true in healthcare, where speaking clearly and correctly is not just good, but very, very important. Think about a very serious moment when caring for a patient. If one word is not understood, it could cause big problems. In these important times, clear talking is very powerful. This book is made because we understand these hard parts. It is meant to help you as you learn English for your work. In the busy world of medicine, where lives are on the line and every moment matters, talking well is like a strong string holding everything together. If that string is weak, everything can go wrong. When people don't understand each other, even a little bit, it can mean treatments are late, mistakes are made in finding out what's wrong, patients feel more worried, and the healthcare teams get upset. For people who don't speak English as their first language, trying to speak perfectly can be very hard. It adds more worry to a job that is already hard. This book will help you. We will give you the important English words and ways to talk that you need to feel sure of yourself. Our goal is to give you power, not just with words, but with the feeling that you can talk well with your patients and coworkers. This will help make sure care is always safe, quick, and kind. The main reason for this book is simple, but important: to make patients safer and to help healthcare teams work better. We do this by giving you important English words for medicine and ways to talk, made just for healthcare workers who are not native English speakers and work where English is spoken. Think of it like this: when you can say and understand English medical words and sentences with confidence, you make things safer for your patients. They feel heard and understood, which makes them less worried. Your coworkers can trust what you say, making teamwork easier and faster. This book will help you build that confidence. It will help you learn the language of care so your great skills can be seen without language getting in the way. At the center of how we teach is the idea of medical English communication. This is not just about learning lists of medical words, though that is a big part. Medical English communication is using English well in the healthcare place. It means understanding and using special medical words the right way, of course. But it also means being able to talk well with patients who might feel sick, worried, or scared. It's about talking clearly with your coworkers, doctors, nurses, helpers, and technicians. Being able to understand and be understood is very important, so everyone knows important health information, so mistakes are fewer, and so patients get the best care, especially in places where English is the main language. In this book, you will find important words, useful sentences for common medical situations, and clear lessons that are easy and fun to learn. We will talk about how to describe what hurts, how to explain treatments, how to understand what patients are worried about, and how to work well with your team. Each part of the book is like a step to help you get better at medical English communication. We think learning should make you feel stronger. We made this book to be your helpful friend, giving you tools and knowledge you can use right away in your work every day. Let's start this journey together. By learning and using medical English communication well, you will not only do better in your job, but more importantly, you will make the care you give much better. Turn the page and let's start talking more clearly for better care. 1. Learning medical words in English. The world of medicine has its own special language. It's like a secret code for every pain, every fix, and every tiny part of our bodies. For those of us learning this language later, it can feel like standing outside a locked door. But remember, everyone who knows a lot started by knowing very little. Learning to talk and write well in medical English is a great journey. It's not just about knowing new words, it's about being able to help people in the best way possible. Think about it. One small word, used the wrong way, can change what a doctor thinks is wrong, change how someone is treated, or worse, make a patient feel lost and not heard when they are most worried. This is why learning the right English words for medicine is so important. It's not just studying, it's key to keeping patients safe and working well as a team. When we use the right words, we build clear paths for understanding. This helps important information travel smoothly between us, our patients, and our coworkers. This clearness is the base of trust and the heart of medical English communication. It means using English in a healthcare setting with special words and clear ways of talking to help patients and make teams work better. Let's look at someone like Anya, a nurse. When Anya started at an English-speaking hospital, she was ready, good at her job, and kind. But there were so many new medical words. She would stop, looking for the right English word, sometimes using a word that was close but not exact. One time, she needed to talk about a patient's trouble breathing. Instead of saying shortness of breath, she said difficulty breathing. People could understand her, but the more exact word, dyspnea, is what her coworkers would know right away and might link to certain causes. Another time, she wanted to talk about a procedure with sutures, but used the simpler word stitches. These might seem like small differences, but in busy hospitals where mistakes can be serious, exactness is vital. Every word is like a key that opens a specific understanding. The dangers to patient safety when medical words are not understood are very clear. Imagine a doctor asking for morphine, but the nurse brings meropenem by mistake. The results could be very bad, from not helping with pain to dangerous mix-ups with medicines. Or think about a patient saying their pain is sharp, but the healthcare worker hears it as dull. This mistake could mean a serious problem like appendicitis is not found, because a sharp, local pain is a key sign. These are not just made-up stories. These are real risks when the special language of medicine is not spoken with perfect clarity. Every word spoken or heard wrongly can be a weak spot in keeping patients safe, and our effort to learn these words helps make that safety strong. So, how do we build this needed word list? It's more than just reading a book of words, though that's a start. The real learning happens when we learn words and how they are used, and then use them ourselves. Think about the word hypertension. If you just see it in a list, it's just a word. But if you hear a doctor tell a patient, your blood pressure is high, which means you have hypertension, and then you read it in a patient's file about their health, the word gets meaning. You see it used, you hear it spoken, and you start to link it to the real situation of managing high blood pressure. This is the power of seeing and hearing things again and again in different situations. Our brains are built to remember things that matter to us. This brings us to building your own medical word list. This isn't about collecting every medical word ever known. Instead, it's about creating a useful tool that fits your job and your work. Imagine a small book or an app on your phone where you write down new words you find. Next to each word, write its simple English meaning. Most importantly, add a sentence showing how it's used in healthcare. For example, if you learn edema, you might write, edema, swelling because there is too much liquid in the body's soft parts. Example, the patient's ankles looked swollen with edema after the long trip. Or for palpitation, feeling your heart beat very fast, strong, or unevenly because you are worried, tired, or sick. Example, she said she felt palpitations when she was stressed. This personal list becomes your own special dictionary, showing your learning and helping you remember. Besides your own notes, there are many ways to surround yourself with medical English. Many of us have learned from medical shows on TV. While remember these are often made for drama and not always correct, they can be good for hearing common medical words and talking. Just be sure to check what you learn with good medical sources. Online medical dictionaries like Medline Plus or the Merck Manual are very helpful. They give clear meanings and often tell you how to say the words. Phone apps with flashcards like Quizlet or Anki are great for reviewing words over time. This helps them stay in your memory. Going to English-speaking medical talks, classes, or even meetings at your hospital can also be very good. These are chances to hear experts talk about hard subjects using exact words. Don't be afraid to take notes. And if there's a time to ask questions, try to ask one, even if it's just about a word you didn't know. Doing this helps you learn better. Also, try to find someone to practice English with. Another healthcare worker who wants to get better at English. Or maybe someone who speaks English and wants to learn your language. Practicing talking with them, focusing on medical situations, can be a safe and good way to feel more sure of yourself. When you are just starting, it's easy to feel like there are too many new words. The main thing is to focus on the words you hear and use most often first. What words do you hear and use every day? What are the common problems, sicknesses, and treatments in your area of work? Focusing on these will help you talk much better right away. For example, knowing words like fever, cough, pain, medicine, diagnosis, treatment, patient, and doctor will help you in many different situations. As you feel more sure of yourself with these basic words, you can then learn more special words. This brings us to the next important question. How can a healthcare worker practice using new medical English words in a way that builds confidence and helps them remember more than just reading? The answer is in careful, regular practice that goes beyond just knowing a word to actually using it. One good way is called practice talking. After learning a new word, try to explain it out loud to yourself or to a pretend patient. For example, if you learned anemia, a condition where the body doesn't have enough healthy red blood cells, practice saying, "You have anemia." This means your body needs more red blood cells to carry oxygen. We will do some tests to find out why. This talking practice helps you learn the sound and how the word fits naturally in a sentence. Another strong method is using it in a situation. When you find a new word, think about a real patient situation where it could be used. If you learn about jaundice, skin and eyes turning yellow because of liver problems, picture a patient with this problem. What questions would you ask? What would you look for? How would you tell a doctor about this? Thinking through these situations, using the new word, makes it stick much better than just reading its meaning. For example, you might think, if I see a patient with jaundice, I will look at the color of their skin and eyes, ask if they feel itchy or have dark pee, and tell the doctor, the patient looks jaundiced. Acting out scenes is also very helpful. If you have a coworker who is also learning, or even a friend who will help, set up practice times. One of you can be the patient and the other the healthcare worker. Use real medical situations and try to use the new words you have been learning. This practice in a pretend setting helps connect what you know to how you actually use it. It also gives a safe place to make mistakes and get gentle help, which is key to feeling more sure of yourself. Also, looking for chances to use new words in your daily work is very important. When you learn a new word, try hard to use it when you talk to a patient or in a team meeting if it fits. Start with easy situations. Maybe you can use it in a note you write or in a quick talk with a coworker. For example, if you learn dysphagia, trouble swallowing, and you have a patient who is having trouble eating, try to use that word when you talk to a nurse or doctor. I've noticed Mrs. Smith is having some dysphagia. She seems to be having trouble swallowing her food. Even if you don't say it perfectly, trying to use the word shows you were trying to learn and helps you remember it. Finally, don't forget how important it is to think about what you did. At the end of your workday, take a few minutes to think about the new words you heard and how you used them. Did you use them the right way? Did people understand you? If you made a mistake, what can you do differently next time? This thinking time is a vital part of learning, helping you see what to improve and making sure you remember what you learned. By actively using new words through practice talking, using them in situations, acting out scenes, trying to use them on purpose and thinking about it, you change what you know into confident ways of talking. Once you have a good base of important medical words, the next important step is to learn how to use these words well in real talks. This means not just knowing the words, but knowing how to put your sentences together, ask clear questions, and listen closely. The next part will look at these important ways of talking, moving from single words to smooth conversations. 2. Improving communication for doctors and nurses. The hospital hall was busy but quiet. You could hear soft beeps, quiet footsteps, and people talking in low voices. This is a very important place where people's lives can change quickly. The words spoken here, or not spoken, are very important. For doctors and nurses, speaking clear English is not just a job skill. It is key to keeping patients safe and giving them good care. This is where medical English communication helps a lot. It makes the difficult world of healthcare a place where people can understand each other, even if they speak different languages. Imagine a Dr. Anya Sharma. She cares deeply about her patients, but sometimes finds it hard to say the right English words to explain a serious illness. Or a nurse, Marco Rossi. He is kind and gentle, but worries his English might not show how urgent a patient's needs are. Many good healthcare workers feel this way. It's not that they don't know or don't care. They just need the right words to help them connect. One of the most important parts of a doctor's or nurse's job is understanding what patients are feeling. This means more than just hearing words. It means truly understanding what they are worried about, how they describe their problems, and their health history. For example, a patient might say they feel discomfort instead of pain. These words are similar, but discomfort might mean it's not as bad, or it's been happening for a while. Knowing the difference and asking questions like, "Can you tell me more about this discomfort? Is it sharp, dull, or aching?" helps make things clearer. Also, when asking about a patient's past health, it's important to know about allergies versus intolerances. A patient might say they are allergic to a medicine, but what they really mean is they get a rash. A true allergy can be very dangerous, but an intolerance might just cause an upset stomach. Asking, "What happens when you take this medicine?" or "Can you tell me more about your reaction?" helps doctors and nurses get the right details. This stops mistakes that could lead to wrong treatment. Asking these careful questions with kindness is the first step to getting the diagnosis and care right. It is also very important to explain health information in a way that patients can easily understand. Imagine a doctor needs to explain a treatment plan. Using difficult words like administer prophylactic antibiotics intravenously can be confusing for someone who is already sick and worried. Instead, saying, "We will give you some medicine through your vein to help stop infection," is much clearer and makes the patient feel better. When talking about medicines, just saying the name and the amount is not enough. Patients need to know why they are taking it, how to take it, and what might happen. Simple explanations like, "This pill will help lower your blood pressure," or "Take this with food so your stomach does not get upset," are very important. Explaining possible side effects also needs careful words. Instead of saying, "You may experience gastrointestinal distress," A doctor or nurse might say, "You might feel a little sick to your stomach, or maybe have loose stools. If this happens, please tell us." This kind of clear, simple language helps patients feel in control. It makes them more likely to follow the plan, which is a big part of medical English communication. Healthcare is a team effort. Doctors and nurses talk to each other and to other healthcare workers all the time. For example, when one nurse's shift ends and another begins, the first nurse needs to tell the second nurse important things quickly and clearly. This might be like saying, "Mr. Henderson in room 302 is doing okay, but his blood pressure was a little low this morning. We gave him fluids and it is back to normal now. He needs his wound dressed at 10 a.m. This short message gives important details: where the patient is, how they are doing now, what happened and was fixed, and what needs to be done soon. If the English is not clear, important details could be missed, which could affect patient care. Also, when a doctor needs to talk to a special doctor or discuss a patient's case, using clear medical English makes sure everyone understands. Phrases like, "I would like a heart doctor to see Mrs. Davis in room 415. She is having chest pain for the first time, and she has high blood pressure," are quick and give the needed information and why it is urgent. This clear, standard way of talking within the team is a strong way to prevent mistakes and make sure patients get care without problems. This is a main idea of medical English communication. More than just sharing information, good communication in English is about building trust and having a real connection with patients. When a doctor or nurse speaks with confidence and care, using words that are both professional and kind, it can greatly change how a patient feels. A simple phrase like, "I understand this must be difficult for you," or "We are here to help you through this," can make a big difference. Showing you truly care with your words and how you speak can ease worry and make patients feel important and respected. This connection is not just about making patients feel good. It also helps them want to follow their treatment plans. A patient who trusts their health care provider is more likely to take medicines on time, go to follow-up visits, and talk about any problems they are having. This human connection, made possible by clear and kind English, is a powerful part of getting better. It is also important to know that how people talk can be very different in different cultures. What is seen as direct and helpful in one culture might seem rude in another. For example, some cultures speak in a less direct way and may share worries softly, while others prefer to be direct. A doctor or nurse needs to be aware of these possible differences. If a patient from a culture that uses less direct talk seems shy to speak freely, a healthcare worker might try asking questions in a more open way, like, "Is there anything else on your mind about your health today?" Instead of directly asking, "Are you having any other symptoms?" Also, understanding that some patients might not look you in the eye because of their culture, and not thinking they are not interested, is important. Knowing and respecting these cultural differences, while still sharing important medical information clearly in English, helps give better and more inclusive care. This understanding of different cultures, mixed with medical English communication, makes sure care is not only medically correct, but also fits the patient's culture. Let's think about a situation. Nurse Alina Petrova was new to a hospital where everyone spoke English. She saw that an older patient, Mr. Davies, seemed quiet and did not want to talk about his pain. Alina's first thought was to ask directly, "Are you in pain, Mr.?" But he would just nod or say no. Alina remembered learning about cultural differences and how important it is to build trust. Instead of pushing, she sat by his bed and spoke softly, "Mr. Davies, sometimes when we get older, our bodies feel different. Is there anything that feels uncomfortable for you today? Even a little bit?" She used simpler words, not medical terms. Mr. Davies looked at her, a little relief in his eyes, and then slowly said, "My leg aches, dear. Especially at night." Elena's patient way, using kind, easy-to-understand English and showing she cared, helped Mr. Davies share his needs. She then explained clearly, "This ache can make it hard to sleep, can't it? I will tell the doctor, and we can see about getting you something to help with the pain tonight." By changing how she spoke and using clear, simple English, Elena not only understood Mr. Davies's pain, but also started to build the trust that is so important for him to get better. This moment showed Elena how medical English communication can help people connect and make sure every patient feels heard and cared for. The ability for doctors and nurses to handle these different communication challenges, understanding small signs of illness, explaining treatments, working with colleagues, building trust, and respecting cultural differences, is very important. It is more than just speaking English. It is about speaking English well in the special and demanding place of healthcare. This careful use of words makes sure that diagnoses are correct, treatments are understood, and patients feel safe and supported. We have talked about how important clear English is for doctors and nurses in taking care of patients and working as a team. Now, we will look at the specific language needed for communicating with patients beyond symptoms, which is about building a good relationship and understanding what the patient is going through. 3. Importance of good communication in healthcare. In the heart of caring for people, where lives are very important and trust helps people get better, talking is more than just using words. It is like a hidden string that connects a patient who is worried to a nurse who cares, a doctor who works hard to a surgeon who is good at their job, and a team working together for one aim: to help the patient get well. For you who are starting your jobs in places that use English to care for people, learning to speak well in English is not just learning a new language. It is about being able to give the best and kindest care. Think about it. Every day, you need to understand what is wrong with people, explain what their sickness is, and tell them what to do. When talking goes smoothly, like a clear, calm river, everything works well. People feel heard, they get what they need, and they follow the steps to get better. But what happens when the river is rough and words are lost or not understood? Bad things can happen, not just to the person who is sick, but to the whole team. Let's think about something that could happen in any busy hospital. Imagine a new patient, Mr. Shen, comes in because his chest hurts a lot. He does not speak much English. The nurse who checks him in, who is very busy, asks him quickly, "Do you have any allergies?" Mr. Shen, feeling sick and worried, nods. He thinks she is asking if he has any problems. He is allergic to penicillin, a common medicine. He does not say it clearly, and the nurse, maybe not hearing him well or understanding him, asks the next question. Later, a doctor, wanting to help him with a possible sickness, gives him a medicine that has penicillin. The nurses give him the medicine, and in a few minutes, Mr. Shen starts to have trouble breathing and his skin gets red bumps. He has a bad reaction to the medicine, which can be very dangerous. No one meant to make a mistake, but a very bad problem happened because of a simple but very important mistake in talking. The allergy was not understood well, the information was not given right, and a moment where the patient's life was in danger happened. This happens more than you think. This shows why medical English communication, using English very carefully in healthcare, is so important. It is about stopping these moments and making sure every word helps people get better and stay safe. This is why learning to speak English well is so important in your job. The most important reason is patient safety. Every time you talk to someone, from asking about their health to explaining how to take care of themselves at home. You can be clear or cause confusion. When you can clearly understand someone telling you about their pain, where it hurts, how bad it is, what makes it better or worse, you get important clues to know what is wrong. When you can explain a medicine, why it is used, how to take it, and what might happen if it causes problems, in simple English that people can understand, you help them take their medicine right and avoid mistakes. On the other hand, if there is a misunderstanding about how much medicine to take or how to take care of yourself at home, it can lead to wrong treatment, bad reactions to medicine, or not getting better. Clear talking means safer care. It is not just about not making mistakes. It is about building a safe wall around everyone who comes to you for help. Besides helping the patient directly, talking well in English is very important for a healthcare team to work well. Hospitals and clinics are like busy places where many different people must work together smoothly. Doctors, nurses, pharmacists, helpers, and office staff all have important jobs. For all these people to give good care, information must be shared easily and correctly between everyone. Think about when one nurse finishes their shift and tells the next nurse about a patient. A clear, short report, spoken in simple English, makes sure no important detail is forgotten. It means the next nurse knows exactly what happened, what medicine was given, and what to watch for. Without this clarity, jobs can be forgotten, medicine can be given twice, and the patient's care can be bad. This not only affects the patient, but also makes the team stressed and less efficient. When talking is good, the team works like a well-oiled machine, making choices fast, solving problems together, and giving better care. It makes everyone feel valued and understood, which makes their jobs happier and less tiring. Also, being able to talk well in English is key to building trust and a good relationship with patients. When a patient feels that their worries are heard and understood, when they can ask questions and get clear, helpful answers, they start to trust the people taking care of them. This trust is very important. It is the base of the relationship between the caregiver and the patient. A patient who trusts their doctor is more likely to talk about private things, to follow difficult treatment plans, and to feel like a partner in getting better. Imagine a patient who has just been told they have a serious sickness. They are probably scared and confused. If their doctor can sit with them, explain the sickness in simple words, answer their questions with patience, and show them a clear way to get better, the patient will feel supported and less alone. This kind of caring talk, in clear English, can change a scary experience into one where the patient feels stronger and hopeful. It is about more than just giving medical facts. It is about showing you care, are kind, and understand. How well you talk also affects you, the healthcare worker. Always having trouble with words can be very stressful and tiring. Imagine being in a very important moment, needing to tell someone something urgent quickly, but you can't find the right words or worry about being misunderstood. This worry can make you tired, make your job less enjoyable, and make you less effective. As you get better at speaking English, you feel more sure of yourself. You feel more in control, more able, and less worried in hard situations. This new confidence not only makes your work more pleasant but also lets you focus more on your patients instead of on how to talk. It is a good cycle. Better talking means less stress, which means better care. Finally, we cannot ignore the legal and moral reasons why clear English talking is so important. In many places, healthcare workers have a legal duty to talk clearly with their patients. This means explaining sicknesses, treatment choices, risks, and benefits in a way the patient can understand. Writing down patient information, instructions, and agreements correctly in English is also very important for legal protection and to be held responsible. If there is a misunderstanding, in some cases, a patient might sue, saying they were harmed because of not talking properly. Morally, giving care without making sure the patient understands can be seen as not doing your job right, because it takes away the patient's right to make choices about their health. So, working on your English talking skills is not just about making yourself better at your job. It is about doing your job duties right and protecting yourself and your workplace. Let's look closer at how one small misunderstanding, even if it seems small at first, can grow into a big risk for patient safety. It is often like a chain of events. For example, a patient might tell a nurse, "I feel a bit dizzy." If the nurse, because of a language problem or being rushed, does not ask more questions, like when the dizziness started, how bad it is, or what the patient was doing when it happened, that small piece of information might be lost. Later, a doctor might look at the patient's chart and only see dizzy. Without the details, the doctor might not think it is a side effect of a new medicine or a sign of a more serious problem. If the patient then stands up quickly to go to the bathroom, the dizziness could make them fall and they could break a bone. This fall and the injury might have been completely avoided if that first, small conversation had been more complete and correct. The first dizzy was a warning, but the lack of detailed talking meant the warning was not heard, leading to a series of events that put the patient in danger. This shows how every word, every detail, matters in the complex world of healthcare. Besides just being understood, what are the special good things about talking in a way that is planned ahead and shows you care when building a strong team that works well together? It is much more than just sharing information. Talking ahead means thinking about what might be needed and what problems could happen. For example, a nurse might tell a patient before giving them a shot, "I am going to give you a shot now. You might feel a small pinch." This simple warning can make the patient less worried. Within the team, talking ahead means a doctor might call the lab to let them know a sample is coming quickly, or a nurse might tell the office helper that a patient will need a wheelchair for an appointment. This planning stops delays. Talking with care, on the other hand, means truly understanding and accepting how others feel. When a team member is having a hard time, a caring response, "I see you have a lot to do right now. How can I help?" can make a big difference to how everyone feels. It builds respect between people. When coworkers feel that their work is noticed and appreciated, and that their worries are taken seriously, they are more likely to help each other. This leads to better ways of solving problems because people feel safe to share their concerns and suggest ideas. Instead of blaming, there is a shared effort to find the best way forward. This kind of talking builds a base of trust and safety, where mistakes are seen as chances to learn and not as failures, and where new ideas and constant improvement can grow. It changes a group of people working in the same place into a strong team working towards shared goals. Understanding how important good English talking is the first step. It is a powerful understanding that your words, spoken or written, have direct and big effects on people's lives, how teams work, and your own work journey. Now, let's look at the parts that build this skill, the important words and phrases that will help you talk with confidence and clarity in every healthcare situation. 4. Essential vocabulary for interacting with patients and colleagues. In a busy hospital or clinic, every word matters. It's not just about speaking English, it's about speaking healthcare English. This is the language that helps you, your patients, and your coworkers understand each other. This special way of talking is called medical English communication. It is the most important part of giving safe and good care. It means that when you talk about a patient's health problem, how to treat them, or something important you see, Everyone knows exactly what you mean. This is very important in English-speaking places. Clear talking keeps patients safe and helps the team work well together. Let's think about an example. Nurse Anya is still learning English. She is taking care of Mr. Henderson, an older man who just had an operation. Anya needs to tell him how to take his new pain medicine. She knows the words for pain and medicine, but she finds it hard to say exactly how much to take and when. She tells him, "Take this pill 2 times when you feel bad." Mr. Henderson is still a bit sleepy from the medicine they gave him. He nods, but he isn't sure if she means to take it 2 times every day or only when the pain is very bad. He might take too much medicine or not enough. This could make his healing slower. Later, when Dr. Lee asks Anya about Mr. Henderson's pain, Anya uses simple English. But she doesn't use the special way the doctor asks, like on a scale of 1 to 10. This small difference in words and how they are said can cause confusion. It can make the patient worry and might delay the right care. This is why learning the most important words is so helpful. It gives you the tools to build trust with patients and to work smoothly with your team. Important words for talking with patients and co-workers. When we talk about medical English communication, having the right words is a big part of it. Think of it like building a house. You need strong bricks and strong beams. For people who work in healthcare, these bricks and beams are your words. They help you connect with the people you care for and work with every day. Words for talking with patients, building trust, making sure they understand. Talking to patients is like a careful dance. They might be scared, in pain, or confused. Your words can either help them feel calm and understand, or make them worry more. Using the right English words when you are with patients is like offering a steady hand. It shows you are a professional, that you care, and most importantly, that you can explain what is happening clearly. Let's look at some common times when using special words makes a big difference. Asking about a patient's health. When you ask a patient about their health, you need words to understand their problems. Instead of just saying "I feel bad," we need to know how they feel bad. Pain. Is it a dull ache, a low, constant pain, a sharp pain, a sudden, strong pain, a throbbing sensation, a pulsing pain, or a burning feeling? Knowing these words helps you understand the type of pain they have. Other problems. Do they have a cough, a fever, feeling hot, shortness of breath, trouble breathing, nausea, feeling like you might throw up, dizziness, feeling like you might fall, or swelling when a part of the body gets bigger? Being able to name these clearly is the first step to finding out what is wrong. How long and how often? When did the problem start? Is it constant, happening all the time, intermittent, happens sometimes but not always, or does it happen daily, every day? Explaining tests and treatments. When you need to tell a patient what will happen, or how to take their medicine, being clear is everything. For a test, you might say, "We need to do a biopsy." This means we will take a small piece of tissue to look at. Or, this is an X-ray. It uses a little bit of light to see inside your body. For medicines, you will take this antibiotic to fight bad germs. Please take this tablet with a full glass of water. This is an inhaler to help you breathe better. Instructions like take 1 capsule every 8 hours or put this ointment on the sore spot 2 times a day are exact and leave little chance for mistakes. Giving instructions. After a patient leaves, they need to know what to do. Make sure to keep the wound, cut, or sore clean and dry. You should rest as much as you can for the next 2 days. Do not lift anything heavy for 1 week. Using simple, direct English, but with the right healthcare words when needed, helps patients feel in control and know what is happening. It's about finding the right balance. We don't want to confuse them with too many difficult words, but we also don't want to be so unclear that they miss important information. Words for talking with coworkers, the language of teamwork and safety. In a healthcare team, being exact is not just helpful, it is needed for safety. When you talk with doctors, nurses, and other healthcare workers, using the correct English medical words makes sure that information is shared correctly and quickly. A mistake in talking between coworkers can have big problems for patient care. Think about when one nurse finishes their shift and tells the next nurse about the patients. If the words are not clear, important details can be missed. Reporting how a patient is, instead of saying the patient is very sick, a nurse might say, "Patient X is unstable, their condition could change quickly," or "Patient Y is having respiratory distress, trouble breathing." These words tell about specific health problems. Describing vital signs like heart rate and blood pressure need special words. Blood pressure is elevated too high, heart rate is tachycardic too fast, or oxygen level is low. Talking about diagnoses and health problems. When discussing a patient's health problem, exact words are used. For example, the patient has been diagnosed with pneumonia, a lung infection, or we think it might be appendicitis, an inflamed appendix. Even telling a doctor about symptoms needs special words. The patient says they feel dyspnea when they are active, which is a more formal way to say they have trouble breathing when they move around. Medicine and treatment details. Using the correct names for medicines is very important. Saying the patient is taking a beta blocker for high blood pressure is much clearer than just saying a heart medicine. When talking about how to give treatment, words like intravenous, given through a vein, often called Roman IV, subcutaneous, given under the skin, or oral administration, given by mouth, are very important. Lab results and pictures from tests. The patient's hemoglobin, a part of red blood cells, is low, or the CT scan, a type of body picture, shows a lesion, a damaged area in the liver. These are common phrases that tell about specific findings. Being able to use these words with confidence when talking to coworkers means everyone understands the same thing. This leads to better choices and a more organized way of caring for patients. Grouping important words for easier learning. Learning a whole new set of medical words can feel like a lot. To make it easier, it helps to divide them into groups. This way, you can focus on what you need most for your daily work. Think about learning like this. 1. By body part. You can learn the words related to the heart and blood vessels, the lungs and breathing, the stomach and intestines, and so on. This is helpful when dealing with problems in these parts of the body. Example for heart: arrhythmia, uneven heartbeat; atherosclerosis, when blood vessels get hard; hypertension, high blood pressure. Example for lungs: bronchitis, when the air tubes get swollen; emphysema, a lung problem; wheezing, a whistling sound when breathing. 2. By common problems. Many patients come in with similar issues. Learning the words for these is very useful. Top 5 most common patient problems and keywords. Pain: a, sharp, dull, throbbing, burning, cramping, stabbing, pressure, radiating, spreading. Fever, temperature: fever, high temperature, chills, sweating, hot, cold. Breathing issues: shortness of breath, difficulty breathing, wheezing, coughing, chest pain, rapid breathing. Stomach problems: nausea, vomiting, diarrhea, constipation, stomach ache, bloating, heartburn. Tiredness, weakness, fatigue, weakness, lack of energy, dizziness, lightheadedness. 3. By types of tests. Understanding the names and what common tests do is important. Blood tests: CBC, complete blood count, electrolyte, salts in the blood, glucose, sugar, cholesterol. Imaging: X-ray, CT scan, MRI, ultrasound. Other, ECG, EKG, heart tracing, biopsy. 4. By types of medical actions. Knowing the names of common treatments. Surgery, incision cut, suture stitch, anesthesia, medicine to prevent pain, recovery. Therapy, physical therapy, exercises to help movement, occupational therapy, help with daily tasks, chemotherapy, medicine for cancer, radiation therapy, using rays to treat cancer. 5. By medicines. Learning common types of drugs and what they do. Pain relievers, analgesics, opioids, NSAID. Antibiotics, antivirals, antifungals. Heart drugs, beta blockers, AC inhibitors, diuretics. Focusing on words you will hear and use most often is the quickest way to build your word knowledge. Bridging the gap. When to use simple words vs. healthcare words. This is where the skill of medical English communication really shows. It's not just about knowing words, it's about knowing when and how to use them. The most important thing is to always make sure the patient understands. For patients, your goal is to be understood. This often means making things simpler. Instead of saying, "The patient had dyspnea," you might say, "The patient is having trouble breathing." Instead of "We need to do a lumbar puncture," you could say, "We need to take a small bit of fluid from your back." However, you still need to use important words that people know or can be easily explained. For example, saying that an antibiotic is a medicine to fight germs or infections is a good balance. Explaining difficult ideas. How do you explain something like inflammation? You can say, "Inflammation means a part of your body is red, swollen, and feels warm." It's how your body tries to heal itself, but sometimes it causes pain. Checking if they understand. This is perhaps the most important step. After you explain something, don't just think they understood. Ask them to tell you in their own words. "Can you tell me how you will take this medicine when you go home?" So, what are the main things you need to remember about taking care of your wound? Does that make sense? Do you have any questions about what we talked about? This checking makes sure your message was understood correctly and lets you fix any confusion right away. It changes talking from just giving information to having a real conversation. Actively practicing and remembering words. Learning words is one thing, using them well is another. Here are some ways to make these words part of your daily work. Keep a notebook. Carry a small notebook and write down new words you hear or need to use. Write down the word, what it means, and an example sentence. Practice with coworkers. If you have coworkers who are also learning English, practice acting out patient situations or talking about cases. Use flashcards. Make conclusion. As you reach the end of clear talk, better care, let's look back at our time together. You have worked hard to get better at using English, and this effort will help you succeed even more. We learned important medical words that help everyone understand each other. We practiced ways to talk that build trust. We learned how important it is to speak and listen well to both patients and other workers. Our main goal is to help you, the caring healthcare worker, feel sure and precise when working in English-speaking places. This journey was about making your medical English communication better. This skill is key for patient safety and for the team to work well. The biggest way good medical English communication helps is by keeping patients safe. When you can hear what a patient is feeling, explain their sickness simply, or tell a coworker something important without confusion, you help stop mistakes and give the best care. A word that is not understood can cause big problems. But talking clearly and with confidence can help someone get better easily or avoid trouble. The important words we learned are not just words. They are the right words to help patients understand and trust you. Good medical English communication also helps the healthcare team work fast. When coworkers can talk easily, passing care from one person to another is smoother, jobs get done together well, and everything works better. This makes things less stressful, fewer mistakes happen, and it makes a better place to work where people help each other. This lets everyone do their main jobs, knowing that talking well helps, not hurts. As you get better at medical English communication, you will feel more sure of yourself. You will feel stronger in your job, better able to handle hard times, and more a part of the healthcare group. This book gave you the basic tools. Using these skills all the time will help you grow in your job and be happier. We know that getting good at medical English communication takes time, especially when English is not your first language. There will be hard times, but remember how much you have already learned by using this book. You are not alone. Many healthcare workers around the world are trying to do the same thing, wanting to be clear and excellent. The knowledge and ways to talk from this book are now yours to use. You can choose to be clear, ask for help when you are not sure, and say what you mean more exactly. Think of every time you talk as a chance to practice and get better at medical English communication. Every talk, every note you write, every time you help a patient is a chance to build on what you have learned. We wanted to give you useful tips that you can use right away in a way that is helpful, just like you help your patients. We believe you can learn, change, and be great. You have the drive, and now you have better tools to help you. This book is a good start, but learning medical English communication goes on. We want you to keep learning all your life. Look for ways to learn more words. Pay attention to new words you hear in your job. Do not be afraid to look them up and know what they mean. Practice, practice, practice. This is the best way to make your skills strong. Find coworkers or friends who can help you practice how to say words, how to put sentences together, and how to listen well. Pretending to do common situations can be very helpful. Listen to medical talks on the radio, watch videos about healthcare in English, and read medical papers. The more you hear and see real medical English, the more natural it will feel. After a hard or very good talk, take a moment to think. What went well? What could you do differently next time? Thinking about this helps you learn and get better at medical English communication. If you are not sure about a word or phrase, it is always better to ask than to guess. This shows you care about being right and keeping patients safe. Use the help you can find at your job, like language help or special classes. Keep looking back at this book's word list and main phrases when you need them. You are a very important part of the healthcare team. Your skills, your kindness, and your hard work are needed. By making medical English communication important and getting better at it all the time, you are not just making your own job better, but most importantly, you are helping to make healthcare safer, work better, and be kinder for everyone. Think of a place where every patient feels heard, where every team member works well together, and where mistakes from not understanding are few. This is the future we are working for, and you are a big part of making it happen. Thank you for learning with us. Now go, talk clearly, and keep giving the great care you are trained to give. Your voice, clear and sure, makes a big difference.